Ever puzzled over the term fibroids? Let's delve deeper. Fibroids, also known as leiomyomas, are growths in or around the uterus. These aren't ordinary, they are complex compositions of muscle and fibrous tissue, forming a unique structure within the body. Their size can significantly vary, making each fibroid unique. Some fibroids can be as small as a seed, almost invisible to the naked eye, while others can grow to such an extent that they cause noticeable expansion of the uterus. The good news is, fibroids are generally non-cancerous, meaning they do not pose an immediate threat to life. However, assuming they are entirely harmless would be incorrect. Factors such as size can lead to varying degrees of discomfort and might cause complications. You might wonder, how common are fibroids? The shocking truth is that fibroids are prevalent, affecting a significant number of women. It's estimated that between 20 to 80% of women will have at least one fibroid by the time they reach 50. Understanding fibroids is essential because, often undetectable and non-threatening, they can impact fertility and cause health problems such as heavy menstrual bleeding, frequent urination, and pelvic pain. Knowledge of fibroids is the initial step towards their diagnosis, management, and treatment, ensuring women continue to lead healthy lives. You may wonder what initiates the growth of these fibroids. The primary cause is currently under extensive scientific investigation, with numerous theories emerging as potential explanations. The involvement of genetics in the formation of fibroids is widely accepted. Research indicates that fibroids often occur in families, suggesting a potential genetic predisposition. This connection could result from specific inherited traits that trigger fibroid formation. Genes responsible for the synthesis of the extracellular matrix, vital for fibroid growth and spread, are under rigorous study. The possibility exists that mutations in these genes could make a woman more prone to fibroids. Another pivotal factor potentially contributing to fibroid growth is hormonal imbalances. Specifically, the hormones estrogen and progesterone, which regulate the monthly development of the uterine lining in anticipation of possible pregnancy, seem to have a significant role. Changes in these hormone levels could cause abnormal cell growth, initiating fibroid formation. This theory is supported by the fact that are commonly found in women of reproductive age, when these hormone levels are typically high. Moreover, recent research has started to highlight the role of diet and stress in fibroid development. High-fat diets and stress may increase the risk of fibroid formation, as excess fat can imbalance estrogen levels and stress can trigger the release of certain hormones such as cortisol. These events can disrupt the body's hormonal balance and potentially stimulate fibroid growth. While awaiting further scientific validation, substantial evidence supports the involvement of hormones, genetics, diet, and stress in fibroid development. As researchers continue to uncover the root cause, it becomes increasingly evident that genes, hormones, dietary habits, and stress levels significantly impact fibroid development. What signs should one look out for if they suspect fibroids, the non-cancerous growths in the uterus? Often, fibroids can be silent invaders, unnoticed for years due to the absence of obvious symptoms. Their symptomatology can range from mild to severe, making recognition difficult. One of the most noticeable symptoms is unusually heavy or painful menstrual periods. Not just typical discomfort, but a drastic intensification. These periods are characterized by excessive bleeding, which can lead to anemia if overlooked, affecting daily activities, causing fatigue and exhaustion. Another symptom is continuous lower back pain, unlike ordinary aches. This persistent pain fluctuates in intensity, making it difficult to associate it with fibroids. This condition can affect your mobility and comfort, making daily tasks challenging. Fibroids may also create a need to urinate more frequently, disrupting your routine. You might find yourself preoccupied with locating bathrooms or managing incontinence. Pressure on the bowel leading to blockages and impairing regular bowel movements is another symptom. This doesn't only cause discomfort but can disrupt your digestive health and overall well-being. Moreover, a constant feeling of or discomfort in the lower abdomen is common among women with fibroids. This sensation, often mistaken for bloating or gas, can cause unease and hinder your ability to enjoy meals. Despite these potential symptoms, it's crucial to remember that some women may remain asymptomatic. Not every woman with fibroids experiences these symptoms, making it essential to seek medical advice if you suspect having fibroids. Diving deeper into the realm of fibroid treatment, let's delve into the various options available and their intricacies. Fibroids are indeed a complex issue, and their management relies on diverse factors such as size, location, severity of symptoms, and your personal health and lifestyle. One common method is medication, often used to manage symptoms. This could include pain relievers for discomfort caused by cramping, providing instant relief from painful episodes. Iron supplements are also used to counterbalance heavy menstrual bleeding, aiding in the replenishment of lost iron and preventing anemia. However, these treatments might not address the root cause and only offer symptomatic relief. On the other hand, hormonal treatments like birth control stabilize your menstrual cycle and help reduce the size of fibroids. These medications can regulate your hormonal balance but may have side effects like bloating, nausea, and potential blood clots. Non-invasive procedures present category of treatment. For instance, MRI-guided focused ultrasound surgery uses sharp, powerful sound waves to obliterate fibroid tissues, providing a non-surgical solution. This technique is only non-invasive but also significantly reduces recovery time. However, this procedure may not be suitable for all types of fibroids and could leave some tissue untreated. Minimally invasive procedures like uterine artery embolization are also a viable treatment option. This process involves the injection of tiny particles into the arteries that nourish the fibroids, blocking their blood supply, causing them to shrink and eventually disappear. Although this procedure has a high success rate, it could lead to premature menopause or potential infection. Finally, there are surgical procedures that carry their own pros and cons. A myomectomy only involves the removal of fibroids but preserves the uterus, making it a suitable option for women who wish to conceive in the future. However, this surgery carries a risk of scars and potential complications during childbirth. In contrast, a full hysterectomy involves the removal of the entire uterus, which is permanent solution but precludes the possibility of future pregnancies and initiates immediate menopause. Crucial to remember that the best treatment option for you is influenced by your unique circumstances. So it's important to discuss these options in depth with your healthcare provider to make the best decision for your health and well-being. Diving deeper into the dietary factors that can exacerbate fibroids, let's start with red meat. Red meat is packed with unhealthy fats that can amplify inflammation in the body. This inflammation can stimulate fibroid growth, therefore it would be wise to limit the consumption of red meat. But don't worry, occasional indulgence is unlikely to cause significant harm. As an alternative, consider lean meats like chicken or turkey, or plant-based protein sources like legumes, which are less likely to cause inflammation. Moving on to alcohol, habitual intake can potentially worsen fibroids by triggering hormonal imbalances. While an infrequent glass of wine may not cause substantial harm, regular drinking can lead to numerous health complications, including exacerbating fibroids. Drinking in moderation is the key. Alternatively, switch your evening glass of wine with non-alcoholic beverages like herbal teas or sparkling water that doesn't affect your hormonal balance. When it comes to refined carbohydrates, foods like white bread, pastries, and heavily processed items are the culprits. They can trigger inflammation and thus augment your fibroids. It's advisable to keep your intake of these foods to a minimum. Instead, opt for whole grains like brown rice or whole wheat bread, which are less inflammatory and provide more nutritional benefits. In conclusion, when dealing with fibroids, it's important to be mindful of these foods. While these are general guidelines, it's highly advisable to consult with a healthcare professional before making significant changes to your diet. Replacing the inflammation-causing foods with their healthier counterparts can help not only manage fibroids, but also contribute towards an overall balanced and healthy. Keep in mind, the way your diet interacts with conditions like fibroids is significant. A balanced diet full of vitamins and nutrients can be instrumental in maintaining overall health and managing conditions like fibroids. Moving forward, let's delve into an in-depth look at the foods that can be beneficial for those battling fibroids. Certain foods have the capacity to exacerbate fibroid-related problems, while others can aid in managing them and even slow down their growth. At the top of our list are green vegetables. These nutrient-dense power packs, rich in fiber and brimming with important vitamins and minerals, can significantly help in reducing inflammation and balancing hormones, key factors in managing fibroids. Dark leafy greens such as spinach, kale, and broccoli are specifically known for their high nutritional value. They can be incorporated into your diet in various ways, such as in salads, soups, or as a dish to your main meal. Next, we have fruits, especially those bursting with antioxidants such as berries and citrus fruits. Blueberries, strawberries, oranges, and grapefruits are all examples of such fruits. These antioxidant powerhouses play a critical role in combating oxidative stress, which is a known contributor to fibroid development. Incorporating these fruits into your diet can be as simple as adding them to your morning cereals, smoothies, or just having them as a midday snack. Lastly, we'll delve into whole grains. Foods like brown rice, hearty oatmeal, and wholesome whole grain bread do more than just fill you up. They help maintain an optimal weight, which is key in mitigating the risk of fibroid growth. These can be easily replaced with your regular refined grains to provide a healthier, fibroid-combating alternative. The mindful inclusion of these foods in your daily meal plan can significantly aid in managing fibroids. However, remember that while diet is a vital aspect of fibroids management, it doesn't operate independently. It is just one part of a larger, interconnected framework. Always consult a healthcare professional for an all-encompassing approach to dealing with fibroids to ensure that your dietary changes are complemented by other necessary lifestyle adjustments. Let's delve deeper into the realm of herbs and their potential benefits for fibroids. These gifts from nature are filled with healing properties derived from the natural world. Incorporating these botanical marvels into your fibroid management plan can potentially bring significant improvements. They function by modulating various biological processes responsible for the emergence and persistence of fibroids, thus providing a comprehensive approach to fibroid management. Our journey begins with green tea. Recognized for its high of antioxidant properties, green tea is more than just a soothing beverage. These antioxidants wage war against harmful free radicals in the body. For individuals with fibroids, green tea could be a natural ally. Multiple research studies suggest it can participate in shrinking fibroids and relieving discomfort caused by these benign tumors. However, excessive consumption of green tea can cause stomach upset and, in severe cases, liver problems. Next, we focus on Vitex, also known as chaste tree berry. Deeply rooted in traditional medicine, Vitex is associated with hormone regulation, a crucial factor as hormonal imbalance often triggers fibroid growth. Vitex potentially inhibits fibroid growth through its hormone balancing abilities, making it a beneficial addition to your fibroid management regimen. Yet, it's important to note Vitex might cause side effects such as stomach upset, rash, and weight gain in some people. Lastly, we highlight milk thistle. This herb is praised for its liver-supporting characteristics. A healthy liver is important in creating a balanced hormonal environment, crucial for managing fibroids. Milk thistle plays a vital role in reducing fibroid size. Although side effects of milk thistle are rare, it can cause diarrhea and bloating in some cases. Remember, while herbs offer undeniable benefits, they are not a replacement for professional medical advice. Always consult with a healthcare professional before starting any new supplement regimen. Similar to the foods we've examined, herbs play a significant role in managing fibroids, but should be part of a comprehensive treatment plan. So, what are the crucial insights that we have gleaned from our comprehensive discussion about fibroids? We've discerned that fibroids are benign, non-cancerous tumors that predominantly occur in or around the uterus during a woman's childbearing years. Although the precise cause remains enigmatic, there's a general consensus that hormonal imbalances and genetic predispositions could play a significant role. Our discourse has touched upon the broad spectrum of fibroid symptoms. These can range from severe menstrual bleeding and pelvic discomfort to frequent urination, backache, and even constipation. However, it's crucial to acknowledge that some women may not experience any noticeable symptoms at all, making it harder to diagnose the condition. We've also delved deep into various treatment options for fibroids, including medications, non-invasive procedures, and surgical interventions. The selection of the most appropriate treatment option hinges on multiple factors, such as your age, health condition, and future childbearing aspirations. Understanding the nature of fibroids is paramount in managing them effectively. Therefore, professional medical is pivotal in accurately diagnosing and treating this condition. Always remember to seek out healthcare if you suspect you might have fibroids, as they can provide the best guidance and support.